See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems. And never has that light been as important as it is right now. Nurses are on the front lines of the coronavirus pandemic. As the entire world learns about the coronavirus and responds to this massive disruption to our healthcare systems and teams, it has challenged nurses to rapidly rethink and redesign our existing care delivery practices and figure out ways to combat a pathogen we know very little about. Over the next few weeks, we're pausing our regular production of See You Now to bring you stories from the nurses in the midst of the coronavirus pandemic as they care for all of us.
It is scary to be in front of people that are probably sick with the coronavirus, even if they have no symptoms. And we have this blind disease. We can't see it. We don't know it's next to us. Any person who is in medicine right now, I salute them 100%. My name is Sigi Marmorstein. I'm a nurse practitioner, been in ER medicine for 26 years, based out of Los Angeles, California. I'm also a telehealth consultant, and I'm the CEO and founder of BabyLiveAdvice, a company we started in 2015, which is a telehealth service that supports expectant mothers and parents from preconception to early childhood virtually. With the outbreak of this coronavirus, everything changed with BabyLiveAdvice. 2 months ago, we had about 100 patients that we would see a week. We had 2,300 patients the last 2 weeks that we have served. I'm working 24 hours a day right now, virtually and on the ground. I'm volunteering my time in the emergency room or in the urgent care. I have helped about 13 different hospitals to start telehealth program in their ICUs and the emergency department. One of the things that are becoming very clear is that moms who have been discharged from the hospital are on their own to monitor themselves for preeclampsia, bleeding, maybe jaundice in the baby, any kind of complication. The ability for us to check in with mom right away and say, hey, how are you doing? What is going on? Are you bleeding? Are you coughing? Are you experiencing high blood pressures? What is going on with the baby? Let's see him. We have an eyes and ears on the patient right now that the health system doesn't have. This is an important component of postpartum care that actually has been neglected for in long enough time. Many people don't know this, but moms are actually at the highest risk, and babies, for any kind of complication from 1 day to 1 year postpartumly, when they go home from the hospital, when they don't have the healthcare system next to them. So I think that this is an opportunity for people to understand that this modality of care, telehealth, the eyes and the ears on the mom and baby, that's something that we have not had before. And now we maybe can start to put that into our healthcare system as a regular modality of care, as something that we should have done before, but maybe now we want to do a little bit more aggressively. In the emergency department, I have treated many corona cases, and everything from very mild symptoms to pretty severe respiratory symptoms. But thanks God, I have not taken care of anybody who was even close to perishing, thanks God. This is the year of the nurse and the midwife, and we should really talk about what does that mean. And it means that nurses and midwives are the supportive of our healthcare system. Without them, this healthcare system will perish. I actually seen for the first time nurses being asked about how to respond to the coronavirus. Nurses are now being valued as the innovator of healthcare. Nurses are now being asked about how we should be managing patient populations as public health systems are crumbling around us. And I think that this is the first time that nurses are being valued also as the first responders. We have the ideas and we have the know-how and we have the knowledge and the compassion to bring forward innovation in a way that nobody else can do it. My message to anybody who's going through this right now is nurses and doctors are here for you. We're here to support you through this crisis. You will not be left alone. Just take it day by day. That makes it a little bit easier to deal with the big picture. Do the best you can, and I hope that we will come on the other side smarter and better.
Sigi Marmorstein is a nurse practitioner based in California and the founder and CEO of BabyLiveAdvice. We're hearing stories every day about the need for more innovative ways to approach this pandemic, about shifting protocols, and the healthcare teams that are increasingly at risk. See You Now serves to support the nursing profession during a time when the role of nurses and their unique contribution have become more visible and vital to the general public and communities than in recent history. As we continue to share the stories of healthcare teams on the front lines, we want to be hearing what you're experiencing. Email us anytime at hello@seeyounowpodcast.com. We're living in unprecedented times. All voices matter. We can't afford to avert our eyes. I'm Shauna Butler, and this is See You Now, and we see you now.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.